Hey everybody, it's Dr. Brace here. Welcome to Facial Plastics Friday. Today I'm going to talk about lower eyelids. We've been having a lot of people calling and asking questions about whether or not they should have surgery versus filler or what options they have for their lower lids. So hopefully I can demystify that for you today. So when we think about lower lids, when I think about it, I think of the layers of the lower lid and what we're trying to address. If you have crepey skin or loose hanging skin of your lower eyelid, then really you have three options. If it's mild, you can probably get rid of that with a chemical peel or a laser peel, so those would be two options. Or third, you could permanently remove it with surgery, so with a skin pinch lower lid blepharoplasty where you actually pinch the skin up, I remove it, and then suture it up. That incision hides right underneath the eyelash line and heals up really well. It's basically scarless. If the issue is dark circles around your eyes, then we have to figure out why is it dark. Is it from a volume loss, or is it just because your skin is thin and you're seeing the maroon colored muscle and the blood vessels under the skin? So if it's the issue of the skin being thin, the simplest thing to do is to try some creams. And so using creams that have growth factors in them to try to thicken the skin can help make that better, but it will never take it away completely. It won't erase it. The other thing you can try is using a fat transfer, which works very well. So doing liposuction on the belly or the thigh, processing that fat so that it's micronized into microfat particles, and then injecting that between the skin and the muscle to put a thin layer of fat to try to thicken up the skin and the distance between the two, and that can really make things a lot better. The trouble with fat grafting is it can be unpredictable and you can have uneven take, and so it may take more than one session to get everything looking good. You don't want to put filler underneath the skin on top of the muscle there, because when light hits the filler through the skin, it will refract and will look blue like a bruise, and that's called a Tyndall effect. Where filler is good is if you have dark creases in your lower lids because of volume loss and you have a shadow. In that case, you can put filler down right on the bone, deep in the cheek here, in the tear trough and the orbital malar groove, and you can lift up that tissue to get rid of that dark crease. Again, there's a small risk of a Tyndall effect and of it looking blue if you put too much. And often that works best if you fill the cheek and the temple around the eye to frame it better, to give it more support so you need less in the orbital malar groove or the tear trough. If you want a surgical approach for that problem where you have volume loss and deep shadows, then we can do fat transfer again for that, or lower lid blepharoplasty. And for that situation, I would do a transconjunctival lower lid blepharoplasty in most people. That means I pull the eyelid down, make an incision on the inside, free up the fat that is protruding and causing the eye bags, and then repurpose it by pushing it down into the cheek and sewing it in the cheek, where it will give you volume. It'll be volume that's your own body, so it'll be permanent. It has a blood supply, so it's permanent and it's predictable, and it can do a really good job at smoothing out those deep creases and smoothing out the eyelid. If you have extra skin and a deep crease, you can do the transconjunctival blepharoplasty and the skin pinch to remove the skin and address both issues, or you can simply do the transconjunctival fat repositioning and then a chemical peel or laser peel if it's a mild skin laxity or excess skin on the lids. So I hope that helps clear up some of the lower eyelid treatments. The other treatment that we can do for the lower eyelid, which is much more rare, would be something called a skin muscle flap. I do maybe one or two of those a year, but that's an incision under the eyelid where we lift the skin and the muscle up, work on the fat, tighten the muscle and the skin, but most people don't need that done. So, little teaser, tell your friends, follow our account. On November 21st, we'll be having a big giveaway. And I don't want to give too much away, but it's over a $2,000 value. We've partnered with all of our favorite Guelph businesses, and we're going to do a big giveaway between November 21st and 27th. So, follow our stories and stay tuned because it's going to be one you don't want to miss. Have a great day.